50 years ago, hospital wards like this reverberated to the sound of ill children with whooping cough or pertussis. It's a serious illness that seems to have gone away, but actually it hasn't. Over the last few years we've started to see sick children again being admitted to intensive care with this life-threatening illness. It's a disease which is serious. Children die, but it can be prevented if we can just improve our immunisation programs. Pertussis is a serious infection of young children. It's best known as whooping cough, and that's because it's quite a descriptive term. It's a disease which particularly affects young children and their throat and their lungs. What happens is they get a terrible hacking cough that just goes on and on. In China it was known as the 100-day cough. It's a paroxysmal cough where children just cough, cough, cough until they go red and then blue in the face. And then sometimes they then make the most characteristic sound, a sharp intake of breath called a whoop, something like this. And then often after that they'll also vomit.
I can't think of too many other infections that can potentially make lungs unventilatable. Despite everything we try in these subset of infants, everything we try in terms of supporting the heart and the lungs on an intensive care unit, there remains a subset of infants that do not respond to treatment. As a result, pertussis still accounts for a significant number of deaths in infants in the UK.
Pertussis is a highly infectious disease, and what happens is when people are coughing, particularly in the first 2 weeks, they blow out millions of tiny droplets, and those droplets can go to the face and into the throat of people nearby, and so through airborne transmission those droplets can cause infection in someone particularly who's close to the infected person, such as in the family or in a daycare centre. Well, immunisation is very effective, particularly in infancy, and it probably protects for 5 to 10 years very well. However, after about 5 years the immunity starts to wane and children become susceptible again. So the illness hasn't gone away. We see it every 4 years. It's become less common as a result of immunisation, but we certainly haven't conquered it yet. Herd immunity is the way highly vulnerable children and adults can be protected against a serious, highly infectious disease because the great majority of people, that is the wider population, are protected against infection because they've been vaccinated. The way it works is if there's, say, one infectious person wearing a red coat and they're milling within a crowd, then that person could pose a risk to the susceptible people, and let's imagine they're wearing white coats. So the white-coated people are highly susceptible, they're not immune, and they will catch infection unless there is a high degree of herd immunity. If you have enough people who are immunised, then those people act as a barrier against infection, so that those in the white coats just don't get infected because the other people get in the way. That's how herd immunity works, but you need high rates of vaccination and immunity to protect the few susceptible people. Pertussis is really poorly recognised in adults, and it's much more common than people realise. In the main, what it causes is a cough that goes on for weeks and weeks. It's quite debilitating in that sense, and it can result in people losing weeks of time off studying or from work.
I contracted whooping cough in my first year at university, so I was 19, and I didn't really realise, I think, what I actually had for some time. I developed a sort of hacking cough. Well, after around 2 weeks of lying in bed, unable to get up, even to go out to the shops, I felt well enough to get on the tube and go into the University Health Centre. My parents always vaccinated me against everything that was going when I was a baby. So I was very surprised when the doctor at the University Health Centre actually recognised the cough that I had and told me that the terrible time I'd been having over the past few weeks was actually whooping cough.
Pertussis remains underdiagnosed, and there are several reasons for this. One reason is that pertussis, not just in infants but in older children and adults, mimics other respiratory infections. Infections that are characterized by a fever, by a cough, by, if you like, flu-like symptoms.
Anil came into hospital at just 10 days of age. This is quite classical for a child to become unwell between about 1 and 3 weeks of age with whooping cough.
The first thing she noticed was the wheeze, so she took the baby to the GP, but he could not give a diagnosis and he referred them to the hospital. They waited there to see the doctor, and once the doctor examined the baby, said the baby was fine, so the doctor discharged them with some paracetamol. The baby got more and more lethargic and stopped feeding, so on the second day Mum became very concerned, and it's 11 o'clock at night she took him back to the hospital. They put the baby on the monitor and they noticed the saturates were very low. He was immediately put on oxygen. Doctors were called, and Mum says one of the nurses actually took the baby to the doctor, and he was sent straight to intensive care unit. It seemed to Mum they were taking blood from every vein. That's when Mum lost control of herself, and Mum thought at that time that she'd lost the baby. He might die.
In infants, there's very little transplacental passage of immunity. There's very little immunity conferred to the newborn baby. And hence, infants who haven't completed their course of primary immunization remain a susceptible group.
We've got twin boys, Sam and Tom, and it became obvious that at 4 weeks there was a serious problem with Sam. The boys were only a month old and we had been getting ready to go to bed, and we had one in a carry cot on the table and Sam on the floor in a car seat, and I happened to look down at him and he was turning blue. So we picked him up out of the car seat and it triggered him breathing. So he started to breathe again, and we obviously called the ambulance. By the time the ambulance came, which was about 20 minutes, he'd had another, which we learnt later was an apnea. And he stopped breathing again, and the ambulance crew arrived and took us into the local hospital. And by the time we were there, he'd had another episode, and they sent the emergency team from St Mary's Paddington. He went straight into the intensive care unit and was in there for, I think it was about a week. And in that time, and when he came out of intensive care, they tested everything to get the cause of these apneas. He had an EMG, ECGs, he had an MRI scan. We also went to the Brompton Hospital and had a 24-hour sleep pattern monitored. And they finally decided he could have gross reflux, and they operated when he was 7 weeks old, and he had this Nissen's fundification on his stomach sphincter, and they tightened it so that he would stop having these apneas. He also had a gastrostomy to be tube fed in case he needed it. He came out of the surgery and then back into intensive care. When he came off the intensive care unit, he was still having apneas. The third culture for whooping cough then came back, and that was the first one that proved positive, which meant that he had whooping cough all along. The third, it was terrifying, him being ventilated and taken in, and the 8 weeks in hospital was endless. You know, he'd had major surgery and he still had a problem breathing, and it just went on and on. As a twin, we've had this comparison all along. He has developed, but he was slower, I think, at first. He's always been smaller, and we've had this problem with feeding. So physically, we've been worried about his growth, and mentally, we've been checking that he's developed and keeping up with his brother.
The best way we can protect children and adults is through prevention, and immunisation is the best form of prevention. So by immunising and having high rates in infancy, we can protect young children. By having a booster before going to school, that provides further protection. And consideration is currently being given to whether on school leaving children and teenagers should also be given another booster to protect them once they're young adults. There's now an acellular vaccine, and the improvement that offers is that you're much less likely to get either a fever or to feel unwell or to have redness at the site of immunisation.
I certainly believe that acellular pertussis vaccination as part of booster immunization to school-going children has a role to play?
I think people didn't realise the need for the booster in the past. I myself and others have been involved in a study in London paediatric intensive care units to demonstrate that actually there's much more pertussis in young children than we really knew. And we only did that by doing PCR and other modern techniques of diagnosis. The reason why I think countries in both Europe, in Australia and the US will be considering, if they haven't already implemented, a vaccine for school leavers, that's a booster against pertussis, is that by protecting young adults, they can also protect the children that they will subsequently have in the next few years.
We think that he probably caught it from our oldest daughter, who was then 11. She did have a cough and it wasn't serious and it wasn't something we would have remembered. And then we do know that Sam had a similar type of cough as well, so we can probably assume that she may have been carrying it, and maybe the rest of us as well.
No, she didn't know that adults could pass it on to children, but after giving birth, when she was taken upstairs, she developed a cough herself, and she does think that she may have passed it on to the baby.
If we can get booster immunizations in, what it will do is perhaps prevent older children in the house and adults in time in the house from passing on pertussis to the susceptible infant.
I mean, I think about that terrible journey, dragging myself from my student accommodation into the university health centre, coughing and coughing and coughing on the tube, surrounded by, other members of the public, including young children.
I would say that it's vital that if there is a booster for adolescents and adults, that it's got to be worth taking. I wouldn't want anyone to go through the experience that we did.